Welcome to my brand new podcast. You are listening to the things nobody tells you about with Marthy Cherubin. And today's episode, as part of our holiday special, we are going to do a recap of some of the things that I have learned throughout my pregnancy and labor that nobody told me about. I'm going to use some audio clips from all of the episodes to highlight those points. I would also like to mention that we are going to take a break for the holidays after this episode. We will return in January with brand new episodes and interviews. We will also be talking about my postnatal story, and one of the interviews will be with one of our new mothers who was tested positive for COVID-19 while she was pregnant with her new baby. So stay tuned. So, what have we learned so far? Here are some of the things that I've learned. 1, talk to other women about their experiences of being pregnant and giving birth. If you don't ask, they probably won't tell you. Their experiences may be useful, and it's a good way to prepare yourself for the journey ahead. Also, keep in mind that some women may not want to or may not be willing to talk about their experiences. As my pregnancy progresses, I started to realize that I don't know as much as I thought I did about pregnancy, which was a bit surprising to me because I grew up in a family full of women. I have a lot of nieces and nephews. I have a lot of friends with children. I used to work with children. So I was a bit surprised because how come nobody told me about this? Why are most women not prepared for pregnancy? I think that one of the reasons why many women are not prepared for pregnancy, labor, postnatal, or even motherhood is because other women who've had children don't want to scare them by telling them the truth. Another reason that I have also found is that a lot of mothers just forgot about it. Or sometimes it's because they've had such a terrible experience that they just want to forget about it. 2, speak up and be your own advocate. There were so many things wrong with that hospital visit. I mean, for one, they could have killed my baby or severely damaged him somehow because they wanted to give me things that I didn't need or want. And 2, they initially ignored my request for a pregnancy test and an ultrasound, even though I was referred to them by my doctor, who is literally down the street from them and who they know. Now, I am telling you, ladies, about this story because of how important it is to be your own advocate, to speak up, especially when you feel like you're not being listened to. As a Black woman, I know not speaking up for myself can mean life or death. According to a reported data from the CDC, in 2017, Black mothers in the US die at 3 to 4 times the rate of white mothers. 243% of Black women are more likely to die from pregnancy or childbirth related causes. 243%. Crazy. 3, stay hydrated and drink lots of water. Around 5 months pregnant, I ended up in the hospital because of something that I later learned was Braxton Hicks syndrome or symptoms, and I was also diagnosed with dehydration. I also found out I was supposed to drink 3 liters of water a day, which nobody told me about, not even my doctor. 4, be prepared to morph into a ninja turtle. My feet started to grow, my nose spread, I became very forgetful, and I started to snore very, very loudly. 5, be aware of false labor pains, spotting, hypothyroidism, fibroids, and breech baby. I ended up in the hospital because of something that I later learned was Braxton Hicks syndrome or symptoms. It really scared me because prior to my diagnosis, I thought that I was going into labor at 5 months or I was about to lose my baby. I learned that Braxton Hicks syndrome or symptoms are sporadic contractions and relaxation of the uterine muscle, and they are usually felt around your second or third trimester of pregnancy. They are also referred to as false labor pains. There were a few other things that happened throughout my pregnancy that nobody told me about. I started spotting, which is defined as light bleeding that happens outside of your regular periods. I developed hypothyroidism, which is a condition that is caused by an underactive thyroid gland. It can also be a cause of miscarriage. And to make matters worse, a small fibroid started to grow inside of my uterus. A couple of weeks before my delivery date, the baby was breech, and I had no idea what that meant until my doula explained it to me. Right before birth, most babies are in a head first position in the mother's uterus. Sometimes the baby is in the bottom first or feet first position or sideway. This is what they call a breech baby. And if the baby is not turned, a cesarean or a C section will be scheduled to take the baby out of the womb. Thankfully, my doula referred me to a chiropractor and an acupuncturist who specialize in helping turn breech babies before birth. And it worked. When I went to my next doctor's appointment, they saw that the baby turned and the doctor canceled the scheduled C section. 6, hire a doula if you can afford it, and even if you can't afford it. It's worth it. Trust me. For those of you who don't know, a doula is a support person, usually female, with no medical or midwifery training, who provides a continuous source of comfort, encouragement, and support, both emotional and physical, to a mother or pregnant couple before, during, and after childbirth. A doula may also act as a mediator and an advocate who's there to run interference with hospital personnel, as well as translate medical terms and explain procedures. Together with the doula, I created a birth plan for myself and the baby, which I used to tell my doctors what I want for myself and my baby throughout my labor and delivery. Why did I hire a doula? I hired a doula for a few reasons. One, I wanted to have someone else in the room besides my husband who can provide ongoing support throughout my labor and delivery. Two, this is our first pregnancy, labor, and delivery, so we don't really know exactly what to expect. So we wanted somebody there with experience to guide us through the process. 3, I definitely wanted somebody who would act as my advocate and who would run interference with the nurses and doctors. Black women are systematically ignored and neglected by the nurses and doctors when they go to the hospital. And it doesn't matter how rich you are or how educated you are, if you're a black woman, you are at risk. So you best believe that I was not going to roll up in that hospital without backup. So I got me a doula. 7. Take care of yourself and stay positive. Overall, despite all of the things that happened throughout my pregnancy, I had a pretty positive experience. And the reason that I did is because I made sure that I stayed positive no matter what. I listened to classical music. I stayed away from toxic people. I stopped listening to the news. I only watch comedies, whether it's a sitcom or a movie. And I try to listen to my body as much as possible. For example, I found that apples are great for nausea and heartburn. So I would eat 3 to 4 apples a day, especially the first and second trimester, and the nausea and heartburn will go away. And I never really vomited. I only threw up 3 times throughout my whole pregnancy because I ate something despite feeling repulsed by the smell. So whenever I do not like the smell of something, I don't eat it because if I do, it's gonna make me throw up. 8. The mail doesn't always come on time. So be prepared to be induced if you are past your due date. After my hospital stint when I was 5 months pregnant, everything went smoothly until my due date came around and I didn't go into labor. Labor is the process through which a woman gives birth to a baby. It's the physical effort and periodic uterine contractions to childbirth. Basically, it's the tightening and the shortening of the uterine muscles. And that's what they call contractions. And contractions accomplish 2 things. They cause the cervix to thin and dilate. Dilate means to open. And they help the baby descend into the birth canal. Labor is induced when your doctor gives you medication or uses other methods to make labor start. Your labor may be induced if your health or the health of your baby is at risk, or if you're 2 weeks past your due date. 9. Even when things look seemingly uneventful, they could always take a turn for the worse. So be vigilant. My OBGYN had told me to come overnight so they could start inducing my labor so that I will be ready to give birth by the morning. 1 hour later, they gave me a very small dose of Pitocin. They gave it to me in a pill form. They said it's about maybe 15 to 25% of the pill. They wanted to see how my body is going to react to it. I am also supposed to get the Pitocin about 2 more times throughout the night. Pitocin is a synthetic form of oxytocin used to induce labor. Oxytocin is a powerful hormone that acts as a neurotransmitter in the brain. It plays an important role in reproduction, initiating contractions before birth, as well as milk release. By the time my husband came back to the room from the bathroom, chaos has ensued, and everything was upside down, literally. When he opened the door to the room, I was surrounded by over half a dozen nurses and doctors. I had an oxygen mask on. I was laying upside down on the hospital bed while the overnight OBGYN was pushing my stomach, more like giving my belly CPR. And there were people talking, machine beeping, and my husband had no idea what was going on. Yet, nobody could tell him anything because I couldn't talk. I had an oxygen mask on. I was laying upside down on the bed, and the nurses and doctors were all preoccupied trying to basically save my baby. The baby's heart rate had dropped so low that they were concerned I would lose the baby. So when my husband walked in the room, and since I couldn't talk, I just put my right arm up and gave him a thumbs up as a way to tell him that I was okay, even though I didn't know if I was okay. But I wanted to reassure him a little bit. 10. Build an A team if you can. And I pity the fool who doesn't. No, I'm kidding. But do make sure that you have a support person or a team with you when you are going into labor. The A team, like my doula called it, consisted of my husband, two of my sisters, and my doula as the team leader. Since I labored without any medications or drugs, having the A team with me was godsend. While I was going through my contractions, my doula was massaging my shoulders and my arms, my hands. My husband was helping me do deep breathing exercises, and my two sisters were massaging my feet while putting acupressure on the bottom of them, which literally reduced the pain of my contractions in half. 11. Whether you're planning to have a natural birth or a cesarean, have a birth plan. And remember, it's still your body, so the decision is always yours to make. Remember that. I checked in with my A team to find out what they remembered from that day. When the doctor mentioned the C section, it bothered me a lot that he said that because for the past 9 months, I've been telling him that I would prefer very much to have a natural birth without medication and avoid the C section if possible. So the fact that he had just came in and one of the first things that came out of his mouth was he wants to do a C section. When he came back an hour later, I was dilated 3 centimeters. It seems like my labor was progressing. However, he still mentioned C section. From what the nurses and the doctor himself had told me, my baby is not under duress, I'm not under duress, and my heart is stable, the baby's heart is stable right now, and everything is doing okay. So I'm thinking, if everything is okay right now, why don't you give me a chance to try to have that baby naturally before you already decided that I needed a C-section? Couple of hours later, I was dilated even more. Yet, he still said that he wanted to do a C-section. Now, mentioning C-section like once or twice to me would be okay, but he kept asking me every time he walks in the room. Every single time.
You know what? Maybe this is a bad comparison, but it reminds me of like that story in the Bible where Jesus is in the desert for like 40 days and 40 nights, and every once in a while the devil keeps coming in to tempt him. You know,
That's a perfect example.
Yeah. What do you remember about that, Stephanie?
What I remember, that doctor was, if anything, persistent. Like around the clock, it was just, dude, go away. Like literally, it was, oh my God. Of course, Marthy wanted, if it was, emergency, yes. But if she could deliver safely, that was the plan. Yes. And then if it was way beginning, I think the doctor hadn't made up his mind. Even though Marty was dilated, it's just like he wasn't budging. A doctor like that, you should be planning and partnering with your patient, not just making those arbitrary decisions.
Well, unfortunately, it is the way it is in healthcare. Marty, once you were allergic to Pitocin, that was a red flag for them. They don't want, no matter what you do, they already make up their mind. That was the red flag for them because you're allergic at the beginning of your contraction.
Yeah. To just go back on what you said, Marka, about, you know, the medical profession, how they are. Like, I feel like the C-section become like standardized. And then C-section is a emergency procedure and it's serious.
That's what it's supposed to be.
Exactly. And just it's the safest compared to, if the baby's heart rate dropping low to a dangerous level. I get that, but we didn't get to that point in the decision to have a C-section was already determined. I think that's what I have a problem with. Patients have rights and they should be a part of that decision making. It shouldn't just be the doctor. So the doctor should partnering with the patient. So it was just like they got used to that. Yeah, C-section. I don't know if it's just like a money thing with the insurance.
Yeah, no, exactly.
But it was just that mentality that was behind it.
There's sometimes the doctor go and take easy way out. They have many reasons why they do that. Maybe because they're afraid to get lawsuit or they have so many complexity about why they want to have C-section more often.
I understand complexities. However, there was no need for the doctor to stress me out throughout the whole thing. Maybe he knew from the beginning that I was going to need a C-section or he wanted to do a C-section. But you know what though? I wanted to have this. This is my first child. This is my first experience. That should matter. He could have worked with me, but he had no interest in doing that, even though it was completely possible for him to do it.
It's sort of like this theme that just keeps coming to mind for me is that women's bodies are not their own, or women's bodies, it's like they don't belong to them, even though like obviously they do, but it's sort of like that's the attitude. I don't know if it's like a cultural thing or a medical thing, but that just keeps coming to my mind. And I was like, I thought I should say it.
Most of the time, they don't have no manners, like, you know, especially the doctor nowadays. Maybe back in the 50s, maybe the doctor more about the patient care. Then nowadays, they don't.
Just because that's what they do, we shouldn't accept that as patients. And
of
like
course.
Saying, Eddie, just to jump for a little bit, I think the idea, like the women's body, is just it seems like the doctor has even more rights over it. You're a doctor, a professional, but that's still my body. What my wishes should be considered within that medical clinical judgment that you were providing me with.
Absolutely. And I think that was the fascinating battle between the doctor and the patient that the nurses were experiencing and they were in awe of. This doctor is also extremely strong-minded, strong-willed doctor. And I was an extremely strong-willed and strong-minded patient. So we went at it. But I did it in a very calm and respectful way. Like, forget it. 12. Having a supportive and compassionate doctor makes a world of a difference. So, around 3 o'clock that day, one of the female OBGYNs came in. She checked my cervix and told me that I was dilated 7 centimeters. She said, "This is great. If you're dilated 7 centimeters, you can easily make it to 10. You're doing great. You can do this." It felt like she was a ray of hope because throughout my whole labor, I was dilating. My baby and I were stable, yet the primary OBGYN just kept pressuring me to do a C-section. And in addition to him pressuring me, I only had about a couple of hours of sleep. The last time I ate was almost 24 hours ago. I was in terrible, shocking, excruciating pain. They were starving me. I couldn't even have water. I was only allowed ice chips, just a little bit of it. I had no pain medication. And the only thing that kept me going, that gave me just enough energy to keep going through my contractions and my labor, was the 3 or 4 pieces of nuts that my doula had snuck in for me to eat, because I wasn't allowed to eat anything whatsoever, even though I was literally starving. So when she came in, she was so supportive that it gave me renewed strength. I felt like, wow, maybe I can do this. Maybe I can actually have this baby on my own.
Marty, so just to sum up, like what would you recommend, let's say, going into labor in terms of like a women, especially for first time mothers? What would you recommend?
Well, I think for first time mothers and also other mothers, I think labor is such a scary and unpredictable thing. And I think it's always so important to have support with you. It could be one, it could be two. I was lucky enough to have a whole team of people in the room with me, and I'm forever grateful for that. However, if you can find a way to find one person to come in with you, and that's going to be your advocate while you're there. Because when you're going through labor and all the pain, it's hard to think straight when you are like in excruciating pain. And I also would recommend a doula. Make sure that you find a good one and experienced one too. I think experience matters. And you need to find yourself a doula if you can afford to, or have a support person there with you in the room. And make sure also to you speak up. And if you cannot speak up, make sure that whoever that support person is can speak up for you. So that's really what I would recommend, because even if you had a baby before, each labor and pregnancies are different. So you don't know what's going to happen. Your body might react differently than it did the first time. So it's always good to come prepared and bring backup. As I mentioned earlier, we are going to take a break for the holidays, and we are going to come back with brand new episodes and interviews in January. In the meantime, I would like to wish you all a happy holidays from my family to yours. Happy
Happy
holidays,
holidays,
everyone.
Mom.
At this time, I'd like to encourage all of my listeners to leave a review of this episode and our podcast on Apple Podcast, Spotify, Google Podcast, Stitcher, Amazon Music, Pandora, or wherever you're listening to this podcast. You can also follow us on Facebook, Instagram, Twitter, and subscribe to our YouTube channel. Also, remember to leave a comment about your pregnancy stories, because you might even hear your review and or your stories on the air. So please join us.